As we grow older, we often hear the same advice over and over again. Prevention is better than cure. We're told to get regular checkups, to monitor our health yearly, and that these steps are the key to living a long and fulfilling life. It sounds simple, doesn't it? But what happens when this advice no longer works in your favor, especially after the age of 70? If you're over 70, the reality is that the very same routine that once seemed like the path to longevity could now be a double-edged sword. It's not about ignoring your health or becoming careless. The truth is, our bodies change with time, sometimes in subtle ways, and the way we approach our health needs to change too. At 40, we could get by without much thought when it came to tests and treatments. But at 75, a routine exam or procedure could lead to unforeseen problems or even unnecessary risks. Think of your body as a garden that has been nurtured for many decades. By the time you reach a certain age, it's no longer about constantly digging into the soil or applying every new treatment. Instead, it's about being more deliberate, observing, pruning, and maintaining with care. However, not everyone ages in the same way. There are those who, even at 80, have the energy and vitality many younger individuals envy. But there are also those whose health is compromised by chronic conditions or physical limitations. For them, even something as simple as an annual checkup can sometimes lead to more harm than benefit. The question is no longer, should I get a checkup this year? But rather, does this test or procedure make sense for me right now, considering my body and my priorities? The importance of functional health over chronological age. By the time we reach 30, we've all been told that age is just a number. But when it comes to maintaining our health in later years, age does not tell the full story. It's not about the number on your birth certificate, but about how you feel and function. How well can you move? Do you still think clearly? Can you still enjoy the things that bring you joy? Your health should be measured by your ability to engage in life, whether it's walking around the block or playing with your grandchildren. These factors should dictate the kind of medical care you need, not a calendar. After all, health is about living fully, not about how many checkups you have. As you approach 70 and beyond, you may face different health issues compared to when you were younger. For example, a woman's health routine changes after a certain age, with mammograms and bone density tests requiring new considerations. In men, prostate screenings may no longer be as necessary, as the risks of overdiagnosis could outweigh any potential benefits. Common mistakes with medical tests after 70. The key to maintaining good health as you get older is not about testing more frequently. In fact, it's about knowing which tests are truly necessary and which might do more harm than good. Too often, seniors are led into a cycle of unnecessary medical procedures that can lead to stress, side effects, and confusion. Let's look at some of the most common mistakes that can arise when dealing with medical tests after 70. 1. The overuse of CT scans. As we age, our health becomes even more important to take care of. One common test many people undergo when they have concerns about their health is a CT scan. This type of test allows doctors to get a closer look at the inside of the body, but there's something important to keep in mind, especially as we get older. Many doctors might recommend a CT scan as a routine precaution, thinking it's an easy way to make sure everything is fine. However, what most people don't realize is that a single CT scan can expose you to the same amount of radiation as 400 chest X-rays. That's a lot of radiation. And for someone who has already lived a full life and been exposed to many environmental factors, this extra radiation could be harmful. The issue isn't that CT scans should never be used. The problem is that they are often overused, especially when there might be a safer alternative available. Before agreeing to a CT scan, ask yourself, what exactly are we trying to find? And is there a less risky way to do this? Sometimes, in our search for peace of mind, we end up triggering a series of follow-up tests, which can cause unnecessary stress and additional health risks. Solution: before consenting to any medical test, especially a CT scan, it's important to ask questions. Is this test truly necessary? Could there be a safer alternative that might give the same result without exposing you to as much risk? Taking these simple steps can help protect your health in the long run. 2. Contrast dye and kidney health. Another overlooked risk comes from the use of contrast dye, which is commonly used in tests like CT scans and MRIs. Contrast dye, such as iodine or gadolinium, helps doctors get clearer images during the test. However, many older adults don't realize that these dyes can be harmful to the kidneys, especially as we get older. As we age, our kidneys naturally become less efficient, and they may not be able to handle the added strain of processing these contrast substances. While you might feel fine before the test, the reality is that your kidneys may struggle to process the dye, potentially causing harm. Solution: if your doctor recommends a test that involves contrast dye, it's important to ask key questions. Do I really need this contrast dye? Is there a way to do the test without using the dye? How can I protect my kidneys before and after the test? By asking these questions, you can ensure that you're making informed decisions about your health and minimizing any potential risks. 3. Unnecessary endoscopies and colonoscopies. As we age, health becomes an even more important part of our daily lives. It's common to think that undergoing tests like endoscopies, stomach scopes, or colonoscopies, colon checks, is the best way to make sure everything is okay. These procedures may seem like the safest option, especially if you're not experiencing any obvious symptoms. However, the reality is that these tests come with more risks as we get older. For those over 80, the chances of complications from colonoscopies are significantly higher. The benefit of these tests decreases even more when no symptoms are present. This means that doing a colonoscopy or endoscopy just for the sake of checking may not be the best idea. Instead of jumping straight into an invasive test, it's important to first ask yourself if you're experiencing any symptoms. Are you having persistent abdominal pain? Do you have any digestive issues? If the answer is no, you might want to reconsider undergoing such tests. Overdiagnosis, finding small, harmless abnormalities that would never cause harm, can often lead to more harm than good. Solution: before deciding to undergo any invasive tests, take a moment to assess your symptoms. If you're feeling fine and not dealing with any concerning health issues, there's no need to rush in a test that could pose unnecessary risks. Focus on only getting tested when there's a clear need for it. 4. The full body checkup. The idea of a full body checkup or scan can be appealing. After all, who wouldn't want peace of mind knowing everything is in good shape? But here's the thing. Studies show that up to 60% of older adults who undergo full body scans end up with incidental findings, small, often harmless abnormalities that aren't a threat but lead to further testing and unnecessary procedures. These incidental findings can start a chain reaction of more scans, biopsies, and even surgeries, which might cause more harm than benefit. What started as a simple scan to ease your mind can end up creating more health concerns than it resolves. Solution: instead of going for a full body scan, focus on the areas that matter most for your health. If you're feeling good and there are no troubling symptoms, there's no need to get caught up in a cycle of tests that can cause worry without offering real answers. Stick to regular checkups that are necessary and relevant to your health condition, and avoid unnecessary procedures that might do more harm than good. 5. Prescription cascade. As we age, managing our health becomes more complex. It's not uncommon for older adults to face a situation where their medications seem to pile up over time. It often begins with something small, a slightly elevated cholesterol level, a blood pressure reading that's just a bit too high, or a hint of rising blood sugar. At first, a doctor might suggest a medication to help manage these minor concerns. But over time, those small steps can lead to something bigger, a long list of prescriptions that quickly becomes overwhelming. This situation, often referred to as a prescription cascade, is something many older adults find themselves dealing with. It's a cycle that starts innocently enough, but over time, one medication leads to another. The side effects of one medication can lead to the need for another prescription, and before you know it, you're juggling several medications at once. Each one might seem necessary in its own right, but it can become difficult to know what is really essential for your health and well-being. The issue with this prescription cascade is that as the list of medications grows, it can become harder to keep track of them all. You may find yourself feeling confused about what each medication is for, how it might interact with others, or even how to take them correctly. The side effects of these medications might begin to cause new issues, leading to the need for even more prescriptions. This cycle can quickly spiral, leaving you feeling uncertain and overwhelmed. So, what can be done to break this cycle? The first step is to always ask your doctor about alternatives. Many health conditions can be managed through lifestyle changes, adjustments to diet, exercise, or other habits without the need for medication. It's important to have open, honest conversations with your healthcare provider about whether a medication is truly necessary or if there are other ways to improve your health without relying on pills. Another helpful step is to regularly review your medications with your doctor. Over time, some medications may no longer be necessary, and others may need to be adjusted. A thorough review can help ensure that you're only taking the medications that truly support your health and quality of life. Don't hesitate to ask your doctor if any medications can be discontinued or if a different approach might be more effective for managing your health. Living with multiple medications can feel like a heavy burden, but it doesn't have to be that way. By staying informed, asking questions, and regularly reviewing your treatment plan, you can take control of your health and avoid getting caught in the prescription cascade. Your well-being is worth the effort to ensure that every medication you take is serving its intended purpose, helping you live a healthy and fulfilling life. As we grow older, our health becomes an increasingly important part of our lives. Reaching the age of 70 or beyond is a milestone that brings with it a wealth of life experience, wisdom, and a deep understanding of what truly matters. However, with the passage of time, it also means that our bodies may face new challenges. This is why it becomes even more essential, as we age, to be proactive about our healthcare choices and to take full control of the decisions that affect us. As we age, we may find ourselves in situations where doctors recommend tests or medical procedures. At times, these recommendations can feel overwhelming, and it may not always be clear whether they are truly necessary or if there might be another option available. It's important to understand that you have the right to ask questions, seek clarity, and take the time you need to make decisions that are in your best interest. When faced with a recommendation for a medical test or procedure, don't be afraid to ask questions. Here are some you might consider. Do I have symptoms that justify this test? As we get older, we may experience changes in our bodies that we might not immediately recognize. It's important to consider whether the symptoms you're experiencing are significant enough to warrant a test. Sometimes, a doctor may suggest a test because it is routine for someone your age, rather than because you have specific symptoms that need further investigation. Will this result change my treatment plan? When a doctor suggests a test or procedure, ask how the results will affect your treatment. Will the results lead to a change in how you are currently being treated? Sometimes, medical professionals may recommend a procedure simply as a precaution, but it's essential to understand whether this will lead to real changes in your care. The goal is to avoid unnecessary tests that won't lead to meaningful improvements in your health. Is there a less invasive alternative? As we age, our bodies may not recover as quickly as they once did. Many older adults worry about the potential complications that come with certain procedures, such as surgery. Ask your doctor if there is a less invasive option available. For instance, some conditions can be managed with medication or lifestyle changes instead of surgery. It's important to explore all your options to find the approach that feels right for you. What are the potential risks involved in this procedure? Every medical procedure carries some risk. It's vital to ask about the possible complications, especially if they could impact your long-term health or quality of life. Understanding the risks can help you weigh them against the benefits and make a decision that aligns with your personal health goals. Taking the time to ask these questions and fully understand the answers can make a significant difference in your healthcare journey. After all, your health is yours to manage. In many cases, these questions can guide you toward making decisions that focus not just on ticking off a checklist, but on ensuring that any tests or treatments are genuinely in your best interest. The reality is that, as we age, we become the experts of our own bodies. No one knows you better than yourself. And it's okay to challenge your healthcare providers to help you make choices that reflect what's most important to you: your comfort, your quality of life, and your peace of mind. In doing so, you can feel empowered, knowing that you are taking the necessary steps to make informed decisions about your healthcare. Your journey is unique, and every decision matters. As you navigate this stage of life, remember that you deserve to feel supported, respected, and heard. By asking the right questions, you ensure that your voice remains central in the decisions that shape your health and well-being. With each choice, you're not only safeguarding your health, but also reinforcing the right to age with dignity and care. The reality is, your health after 70 is about much more than just medical tests and procedures. It's about how you feel in your daily life, how well you sleep, how much energy you have, and how connected you feel with the world around you. Your health is not only measured by numbers on a report, but by your ability to enjoy life. So, the next time you face a medical decision, ask yourself, is this test truly necessary for my well-being? Listen to your body. Take control of your health. And remember, sometimes less is more. By focusing on the things that truly matter and avoiding unnecessary interventions, you can continue to live the best life possible at any age.